Hi folks, you're with Tacitus today at your Pushback channel, and thank you for joining this audio, radio, no pictures. Listen to this in your car or truck, or if you're traveling on the train, live stream. In this essay, I'd like to talk about the challenges involved in dealing with, could be call centers or help centers or making medical appointments, medical centers, that sort of thing. Because it seems like the same people are employed in all of these places, and they behave and act in the same way. And they seem to be not there to give service, but there to ask irrelevant questions of things that they appear not to understand and don't want to understand. As long as they're pretending not to understand what you want, then it's a de facto way of denying you service, which seems to be clearly what's going on. Now, I come across it the most. There's an elderly relative, actually more than one now, but the elderly relative, and I help her out by taking her to medical appointments. Now, she's an age where, in a state of health where she's going to medical appointments pretty much every week, and specialist appointments, and it's a real taxpayer-funded gravy train thing for the medical establishment. If you look at the amount of investment firms that have bought into medical centers, then you can kind of go, okay, it's a guaranteed cash cow for them, and so they sink money into it. And the way they make obscene levels of profit is, of course, is maximizing the amount of churn of patients through the place while minimizing the amount of service that they give. And it's obviously a formula that's working well, and for some reason Western governments, or certainly the Australian government, seems to have no interest in stopping it or limiting it or doing anything about it. Anyway, let's have a sort of a look at some of these. Now, I've been able to leave this elderly relative to, if there's any sort of complexity in arranging appointments and times and the scheduling and some of the drugs that she has to take and medication, then I'll get involved, and she calls me. And other relatives are meant to help, but they seem less inclined. And if she's left to her own devices, there's no way she can get these things done. Again, the system is so difficult and loaded against people, and confusing. And of course, the low IQ people that you get on the front line, that she really needs the help from, well, in this case, me, but from a younger relative. Her faculties are failing, and there's no question of that. But I've been able to leave simple stuff to her. So if she just has to call up to get, say, a prescription renewal, just get she's run out of her tablets and she needs a prescription renewal, then she can do that. That's simple enough. But no longer. It's now become that's now the level of complexity that would defy anyone who hasn't got their wits about them. So anyway, this is an example. So she comes to me and says, "Look, I'll do it. I'll do it for you." And I thought it would be. I was more thinking that her faculties are failing her even more so. There's obviously a decline there, but that was my first thought. So I got on the. Now, when you go, you can book these appointments online in theory. But you book an appointment and then you assume that appointment's okay, but it takes over a period of number of days. Then they'll come back to you and say, no, that can't be done, or that doctor won't be available on that day. You have to pick another doctor, which means you have to go back to square one and rebook the whole thing. It's on you to make the change, not on them to fix it. It's your problem to fix. And they're very quick to say, well, no, but that can't be done. You now have to again go back to square one. And that's hardly service. And this is beyond the capacity of, not only the relative, but many people. I think any senior citizen would have trouble navigating some of this. So anyway, I get on the phone to book the appointment. And, the low IQ, youngish woman, low IQ is, and the first thing, rather than give service, they keep talking about their policies. This is policies that don't exist, by the way. So you'd like to make an appointment to see a doctor. yes, it's only a prescription renewal, so any doctor will do. It's our policy. You have to come in and see the doctor," said with much authority. And so, well, I know that. I'm saying I don't mind which doctor it is. It's just a prescription renewal. It's our policy. You have to come in. No one said that they're not prepared to come in. So they like to do this. It's something that they seem to enjoy doing. So they create the straw man that you're fighting them, and they have to fight back. They have to they have to let you know this is the policy and you have to do it. So, again, I said, well, I know that. I'm wanting my relatives coming. Now, this is after you give date of birth, your date of birth, the relative, her date of birth. What's the form number that you have, attorney in medical matters, and that has to be done. Oh, I can't find it here. Oh, wait, you'll have to wait. And you go through all that rigmarole. And I kind of accept that. But why is it so inefficient? Why does that process take so long? It would be my why can't they streamline that? So it goes back and forth, and well, it's our policy. You have to see the doctor, your regular doctor. So, well, fine, but again, it's only a prescription renewal. It's our policy. And I'm inclined to do battle and say, okay, if the policy's in writing, can you show me? They can't. It doesn't exist as a policy. They just say that because it makes them sound tough. And she's a low IQ girl. She's probably given her checklist of things she has to say. She's told, say this, do that. And so she's not, she's not cognizant of what she's saying or its relevance or indeed its implications, or for that matter, how difficult it's making it for the patients. So the doctors found, okay, no, I can't book an appointment for that. Or why not? Well, that doctor's going on vacation. All right, then. Well, given it's your policy that it has to be that doctor, what do we now do? Oh, if the doctor's not here, we can arrange another doctor. That's not a problem. I'll do that for you. Well, you could have done that at the beginning. Fuck. So anyway, it goes back and it goes around and around. Remember, this is just to get an appointment for a prescription renewal. That's all it is. This is no complexity here, no specialists, and then while this is going, well, we can't conduct any operations in the medical centre. You have to go to hospital for that. But I haven't asked for an operation. Oh, I'm just telling you that you can't do it. Well, I already know that, but again, I haven't asked for a medical procedure. Well, it's our policy, and this sort of thing goes, fuck. Now, this is what the relative complained about, this sort of stuff, and I thought she was maybe overstating it but she's not. This is actually what goes on, and it was a full-on battle. For some reason, the receptionist or whoever, the person that books it in, for some reason wants to do battle when you're on the phone, and for someone whose faculties are failing and they're in their mid-80s, why would you want to do a matching of wits? A fight to the death just over booking an appointment. But they seem to want to do it. Are they badly trained? Are they told to do this? What's the now? Another thing came up. There was I thought, by the way, there's a results of the blood test. The doctors called and said everything's fine, and so I just wanted to pick up a copy of it. Now, the reason I pick up a copy of her all her medical test results is that when you go to a specialist, which she has to almost every week, she's going to a specialist of some sort, you need to take that information with you, and if you don't, the specialist will then I need it now. If they can't get it straight away, you then have to make another appointment. Now, sure, the taxpayer covers all her medical bills, but the time it takes to book things to get there, I have to wait for her, or someone has to wait, all this sort of stuff. It's a big job. It takes hours out of the day to do all this driving around and waiting and hand holding and so on. So it's better to have that information with you so that you don't have to make another appointment, or you don't have to wait in the waiting room while the specialists, staff go and try and chase chase that information down, and they won't do anything till they get it, and so on. So it can turn a half-hour appointment into an hour-and-a-half appointment by the time that. So I try and get a copy of it all the time. Now, once the doctor says they don't need to discuss it, it then becomes things. So I've got a note from the doctor here that I can get that information. But the medical receptionist another fight to the death. No, it's our policy not to give those out. Well, the doctors approved it, and by the way, it's when you say it's your policy, that information actually belongs to my relative. It's not yours or the company's. It's hers, her information. So, you've got it's our policy. It's our policy. Fight, fight, fight. Push, push, push. Struggle, struggle. Righteous indignation and all this sort of stuff. And I think you're the sort of people that wave the placards at the fucking climate change protests. I mean, you're that moronic that so you calmly sort of explain it again. But to her, it's defiance. You're defying her authority, and she must fight you for it. Fuck, it's not even worth it. So she insisted to get that. Those results of whatever that fucking medical test was. To get that, you have to come in and make an appointment with the doctor specifically on that matter. Make an appointment with the doctor. It has to be the doctor that commissioned the first test, and it has the policy. Now, none of these policies exist. But I think it's a trend across all over now. I think this is the attitude of service. If I go into a McDonald's store and it's on, and I mentioned this before, and on their website, it's the special where you get the burger and the fries and this, and it's a good price. And I think, oh gee, next time I drive past McDonald's, I'll go in and get that. So you go in and get it, and now the staff, and then they'll call the manager and the assistant manager. It'll be a huge drama and hugely time consuming. And they insist that no such special exists. So then you have to go onto the McDonald's website and show them. They then very grudgingly, and they've been fighting it all the way, very grudgingly. Oh, okay, well, so you're saying that's what you want, is it? Well, it's on your website. It's a McDonald's promotion. They're sending me emails on it. I mean, for goodness sakes, what's the problem here? This is a promotion by the company. I'm in a McDonald's restaurant. Yeah, look. That's a 20-minute wait if you want that. Do you still want to wait? And the look on the face is like, kill shot, nailed you. We're still going to stop you from getting. But why the drama? It's an advert on the website, and this goes on. The medical centre not giving medical service, the restaurant not giving, the food that they're supposed to be supplying, and but also goes into the help centres and technical support centres. So I had a technical support issue a few days ago. A business website that I accessed, which suddenly was saying you don't have a password and wouldn't allow a new password to be set. So it just suddenly happened. So I went on to the help centre, and they said, well, we're busy at the moment, but we'll get back to you in a few hours. It was a week later. I'd forgotten about it. Now, during the course of that week, 3 or 4 days later, the problem actually just suddenly went away. It suddenly came on and suddenly went away. So we don't know. There was some background programming issue or something. I don't know. But so after a week, from India. Now I'd been quite clear about what the problem was. Yet the questions, what were you doing at the time? And after you had logged in, what was the problem? Now, I'd been quite clear that I could not log in because of the password issue, but after you'd logged in, what did you do? Did they not read the thing? I mean, are they not following it? So I went back and explained the whole thing. And again, the response was completely it wasn't any reality. It wasn't responding to what I'd asked or what I'd said. It was something else altogether. And so I'm seeing this issue of pretending not to understand. And it's a process almost of planned obfuscation to prevent delivering the service or the product that's supposed to be available. But they're making it so difficult that people won't do it. Now, in the medical centre's case, they're insisting that everything has to be an appointment in the medical centre, no matter what it is, no matter how small, no matter how trivial or administrative, it has to be an appointment with a doctor. Now, every time you come in, they're racking up another $50. Now, if you're going in just to pick up a report that they should have given you anyway, then they're getting $75. Just for you coming in. They put the bit of paper in your hand, you walk straight out the door, but they're insisting that has to be a formal appointment. Well, they could give it to you at any time or post it out or anything like that. So this is, I don't know, is this a planned scam? Am I imagining this maybe? But it seems to be almost universal. No matter where you go for service, you're finding that same attitude in response. You've been Tacitus today at your Pushback channel. Thank you for listening.